My name is Dietz, and I am part of the STEM Practicum class of 2024. These are my top 5 tips going into the STEM Practicum class. Tip number 5. Picking a site that best suits you. There are many different sites in the Austin area, ranging from veterinary to plastic surgery. It really depends on what you're leaning towards in terms of your desired career path. I suggest broadening your scope to unfamiliar areas of medicine because there will always be something cool to experience. The value of these opportunities at such a young age is astronomically valuable. An example for me would be radiology. I never really knew what radiologists did until I shadowed Seton in the fall. Everyone there really seemed to love their job and had a great passion for seeing what's going on inside of the patients. They were also very eager to teach me about what was happening on the screen when looking in the operation room. A great way to pick a site just for you is to see if there are any family friends that have a career in medicine. This grants you some familiarity with the new environment, while also it's great to cold approach different institutions to ask if they allow shadowing. It is probable that you'll be rejected from some, but that's okay because a lot of places stopped shadowing opportunities after COVID, and there are many sites in Austin. Tip number 4. You want to be proactive at your site. Like I mentioned before, visiting these sites are truly valuable opportunities, and you will want to make the most out of them. A good place to start is by asking as many questions as possible. There are a lot of interesting things going on at our sites, and it makes the experience a whole lot better when you have a good understanding. Sometimes your sponsor won't be as social, which gives you an opportunity to spark conversation. One question I really enjoy asking my sponsors is what their path in medicine looked like. There was one nurse I was shadowing. We'll go with the name Bob. He told me about he joined the Army first and then went to a community college, which was paid for by the military. He got his nursing degree there. They also give you great life advice on what to do and what not to do, and Bob told me not to do hard drugs. Tip number 3. Be considerate to everyone at your site. While this might seem obvious, it does go a long way. Sometimes patients won't want other people watching them, so you just go into a different patient's room until still getting your experience. Another thing is that sometimes your sponsor may be super busy, so it would be better if you shadowed someone else for the day. Also, sometimes you'll just have quiet days. This is a good time to really observe the environment around you and watch how it functions. One example for me is when I was shadowing the PACU compared to other areas of the hospital. I noticed that the lights were dimmer since they had just come off of anesthesia, so it was easier on their eyes when they woke up. Tip number 2. Learn everything you possibly can while you're there. There will be many topics you are unfamiliar with, and it's a good idea to research some of these on your own time. After the first few days at your site, write down common vocabulary words that you hear and either ask your sponsor or look them up for yourself to figure out what's going on. Learn how the tools they're using work and why. Learn the roles of the people around you and what they do to keep the site running so smoothly. Learning is a great way to really dial in what you want to be doing in the future. I developed a pretty good relationship with one of the nurses at my site and have been inspired to look more into scrub nursing. And finally, tip number 1 is to have fun. This is your free time you're spending and you want to be doing something you enjoy. Make friends with people at your site and start conversations. My favorite part of being at my site was watching the surgeries. I got to see how the nurses and surgeon worked together as a team to make sure the patient was safe. One thing that made it really awesome was that there was a huge flat screen TV to view laparoscopic surgeries. These surgeries are where the patient's abdomen is filled with gas and ports are inserted instead of fully cutting them open. My sponsor this spring would always remove the gallbladder and cut it open to show everyone. He called it his specimen, and I thought it was really interesting and funny. Thank you for watching, and good luck at your sites.